Hello, I'm Dr. Bill Bryan, orthopedic surgeon. We're often asked who are candidates for partial knee replacement, full knee replacement, or even the less common patellofemoral kneecap replacement. This all depends on which part of the knee is worn out. If the inside part is worn out, the medial side of the knee is worn out, and more than likely you'll notice you'll be bow-legged. If the x-rays, and sometimes aided by MRI information, it will be possible and desirable to perform a partial knee replacement. The advantages of a partial knee replacement are that it's less invasive, and often this is same-day surgery with the patients being discharged home that afternoon. There is less tissue dissection, the discomfort is less, and the recovery is more rapid when compared with a total knee replacement. For partial knee replacements to work, the remainder of the knee has to be intact. That is, the space between the kneecap and the femur, the patellofemoral joint, and the lateral compartment, the outside compartment. Many patients, however, come to us in the advanced stage of arthritis, where all three compartments are worn out. You may say, what do you mean about compartments? Because the knee is one space. But it truly is. But as physicians and surgeons, we break it down in our minds to look at the space between the kneecap and the femur, the inside compartment, the medial compartment, and the outside compartment, the so-called lateral compartment. And if the x-rays and/or the MRI scans show that 2 out of 3 of these compartments are badly damaged, a total knee replacement is the best option. A total knee replacement has great advantages and some disadvantages. Because it provides a very smooth bearing surface between the metal and the plastic, the nerve endings are not stimulated, and pain relief and walking is pretty much relieved. This is the primary goal of a total knee replacement, to return you to your basic activities of daily living, walking and doing the things that you enjoy the most. Total knee replacements have not yet been perfected to where they will allow vigorous activity. For example, we feel that such activities as lacrosse or football or basketball are really not desirable with total knee replacements. The reason are several-fold. A very active patient will be putting stress on the soft tissues around the knee, and we found that patients with total knee replacements who attempt to return to some of those youthful sports have a great deal of discomfort. Secondly, the materials do have the potential for wear. Now, don't get me wrong, the materials they provided us are very sturdy, but with normal use should last decades. However, if you attempt to run or play basketball or football, the wear of the plastic component in the total knee replacement is at risk. For many patients, the primary problem with their knee is advanced wear of the patellofemoral area. This is the area behind the kneecap, and either the cartilage on the back of the kneecap or the area of the femur where it rides, the so-called trochlea, shows significant wear. Those patients have a great deal of pain in simple things like getting up out of a chair or climbing stairs, and yet the rest of their knee joint is intact, both on clinical exam, x-rays, or MRI scan. Scientists have provided us with a joint replacement to address just the patellofemoral problem. This surgery is often done in day surgery with discharge that afternoon or the next morning. It is less painful than a full knee replacement, and if the remainder of the joint is intact, it may be your option.